Hello guys, I'm Taekun Kim. Today I'm going to talking about dementia. Dementia is a collection of symptoms that are caused by disorders affecting the brain. It's not one specific disease. Dementia affects thinking, behavior, and the ability to perform everyday tasks. Brain function is affected enough to interfere with a person's social or working life. Most people with dementia are older, but it is important to remember that not all older people get dementia. It is not a normal part of aging. Dementia can happen to anybody, but it is more common after the age of 65 years. People in their 40s and 50s can also have dementia. It is estimated that 24.3 million people around the world have dementia, and 4.6 million new cases occur every year. Scientists expect about 43 million people and their families to face the challenge of dementia by 2020. And there are more than 332,000 Australians living with dementia. A few decades ago, only a few medical specialists would have heard of Alzheimer's disease. Senility was considered inevitable for anyone who lived long enough. But as understanding of brain has grown, science has been able to identify and differentiate many causes of dementia. Alzheimer's disease is the most common type of dementia, but other brain disorders can frequently cause dementia. These types of dementia often present themselves with very similar symptoms. Even trained physicians may have a trouble determining for certain which type of dementia a patient has. And some people experience multiple types of dementia called mixed dementia. Here are the four most prevalent forms of dementia. Firstly, Alzheimer's disease. Alzheimer's disease is by far the most well-known and common types of dementia. About 40% of dementia patients are suffered from Alzheimer's disease. Its common symptoms are memory loss, confusion, difficulty communicating, anxiousness, and paranoia. Vascular dementia is also known as multi-infarct dementia or post-stroke dementia, and is the second most common cause of dementia. Approximately 25% of dementia is vascular dementia. Vascular dementia's main symptoms are memory loss, impaired judgment, decreased ability to plan, loss of motivation. Lewy body dementia. Lewy body dementia is the third most common cause of dementia and is also called cortical Lewy body disease or diffuse Lewy body disease. Its main symptoms are sleep problem, memory loss, hallucinations, and frequent swings in alertness. Frontotemporal dementia. Frontotemporal dementia is fairly rare, but believed to be the fourth most common type of dementia. Unlike types of dementia discussed previously, frontotemporal dementia is marked more by behavioral and emotional change than by cognitive impairment. In fact, memory is preserved in the people with frontotemporal dementia. Its main symptoms: decreased inner vision, apathy and loss of motivation, decreased empathy, repetitive or compulsive behavior, anxiety, and depression. Now, we are talking about causes. As the types of dementia are all different, the causes are also various. First, Alzheimer's disease, the most common dementia. The mechanism behind Alzheimer's disease aren't well understood, and there are competing hypotheses. But the most distinguishing feature of Alzheimer's disease is the buildup of amyloid plaques and the tau tangle in the brain. It's widely believed that these brain changes are behind the disease. Amyloid plaques and neurofibrillary tangles are the primary hallmarks of Alzheimer's disease. Plaques are dense deposits of protein and cellular material outside and around the brain's nerve cells. Tangles are twisted fiber that build up inside the nerve cells, which result in the death of brain cells and the breakdown of the connection between them. Vascular dementia, also called multiple infarct dementia, it occurs when the cells in the brain are deprived from oxygen. A network of blood vessels called the vascular system supplies the brain with oxygen. If there is a blockage in the vascular system, or if it is diseased, blood is prevented from reaching the brain. As a result, cells in the brain die, which leads to the symptoms of the dementia. Lewy body disease is caused by the degeneration and death of nerve cells in the brain. The name comes from the presence of abnormal spherical structures, called Lewy bodies, which developed inside nerve cells. It is thought that these may contribute to the death of the brain cells. Frontotemporal dementia caused by damage in the frontal or temporal lobe of the brain. When the initial damage is in the frontal lobe, the main changes are in the personality and behavior. Individuals with damage predominantly in the temporal lobe lose the ability to speak or understand language. As last part of presentation, now I'm going to talking about treatment. To treat the Alzheimer's disease, here are many therapies, both pharmaceutical and non-chemical, which can temporarily increase the functioning and improve the spirit of the person with Alzheimer's disease. But no treatment has proven to be effective. The Alzheimer's Association says, at this time there is no treatment to cure, delay, or stop the progression of Alzheimer's disease. Sadly, vascular dementia cannot be cured, but people who have the ailment are treated to prevent further brain injury from the underlying cause of ailment. Like Alzheimer's disease, numerous medications and therapies may be used to help manage the symptoms. There is no known treatment to reverse Lewy body dementia or address its underlying cellular cause. But as with Alzheimer's and the other main types of dementia, a wide array of therapies and treatments are used to improve the patient's quality of life and alleviate symptoms. Just like other dementia, there is no known cure and no effective way to slow progression of frontotemporal dementia. Cholinesterase inhibitors used as a treatment for Alzheimer's disease usually do not work for the treatment frontotemporal dementia because it affects front area of brain. But much can be done to help manage the symptoms. It is important to learn as much as possible about the disease to help understand and respond to the person's new behavior. People around the individual will need to seek support to learn coping strategies to work around the individual's behavior rather than trying to get the person to change. Speech pathologists may be helpful in teaching strategies to work around the communication problem. Thank you.